Hello and welcome to Benefits Weekly. We're your hosts, Kyle Estep and Eric Johnson. If you work in health insurance and employee benefits, we are your go-to resource for taking complex topics and making them easy to understand. Well, our topic this week is a rarity. It's where government programs like Medicare intersect with employee benefits. And specifically, we're going to talk about the Medicare Part D creditable coverage rules. That's a mouthful. And specifically how a more recent change to the Part D program, which is on paper very consumer friendly, limiting out-of-pocket costs, how that's going to have downstream impacts on employers and people offering group health plans. Now, I know many of you work in benefits, and when the word Medicare comes out of my mouth, you might go, la, 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 I don't want to talk about Medicare, or vice versa. Maybe you specialize in sitting down with consumers and enrolling them in Medicare or ACA plans, and it's la, 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 I don't want to talk about employee benefits. But look, this is an area where they intersect, and it's important we get smart on it. So to kick us off, Eric, I'd love for you to break down what the heck is Medicare Part D. Let's maybe start with our basic building blocks and go from there.
Well, thanks, Kyle. So Medicare Part D is the prescription drug part of Medicare. It is administered by private health insurance companies, and it's been around for about 20 years. And as you said, it is changing, so we'll talk about that in a moment. But basically, Medicare Part D gives Medicare beneficiaries the ability to purchase prescription drugs at a discounted rate, usually for a copayment. Until now, they have sort of had a possibility of being out of pocket up to about $8,000, and that's something that is changing.
Okay, so where does this idea of creditable coverage come in? Let's kind of start talking about that intersection with benefits.
Sure. So basically, if somebody is eligible for Medicare Part D, they should sign up if they don't have other coverage. If they don't, then they face a lifetime penalty. It's basically 1% of the national average Part D premium per month for every month that you delay enrollment, and it's a lifetime penalty, so it goes on forever. But if an employee is working past age 65 or married to someone who is, and they have coverage through the employer, as long as that employer coverage is as good or better than the standard Medicare Part D plan, then it's considered creditable. The employee can remain on the employer plan and they don't end up paying a penalty. But if that employer plan is not as good, if the prescription portion of the employer plan is not as good as the standard Part D plan, then the employee really does need to consider signing up for Part D. Otherwise, they do face that lifetime penalty when they do finally enroll.
Okay, got it. So it really comes down to, at the employee level, if they're offered a group health plan, are the drug benefits, the coverage, the out-of-pocket costs, are they as good as what they could otherwise get on a Medicare program? And that's, I guess, is it considered creditable? Is it equivalent or better, I guess, is the way I'm thinking about it. Does that sound right?
That's correct. And for the employee to know if it's as good or better than the standard Part D plan, the employer is required to send a notice to employees by October 15th, employees and dependents who are eligible for Medicare, by October 15th of each year, letting them know the creditability status of the plans that they are eligible to enroll in. And then separate from that, there's a reporting requirement. The employer is supposed to log on to the CMS, the Centers for Medicare and Medicaid Services website, and let them know the creditability status of their plans.
Got it. Okay, so that letter becomes really important because, let's be honest, the employee is not going to know if it's as good or better than. And so this is, obviously something that folks that have a inkling of understanding of compliance when it comes to employee benefits has probably come across. And folks have been doing it now for years in terms of this creditable coverage reporting and notification.
Right.
But what's interesting, and the reason we're really talking about this today, is because some of these more recent changes to the Part D program. Can you talk a little bit more about those?
Yeah, so the Biden administration made a number of changes in an attempt to improve the Medicare Part D program. Some of those you probably heard about on the news, like the ability for Medicare for the first time ever to negotiate with drug companies on the most popular Part D drugs. But the one that really impacts creditability is that there is now, starting in 2025, a new $2,000 out-of-pocket cap on covered Part D drugs, where in the past a consumer might have been out $8,000 if they had a lot of prescriptions. Now the max is $2,000. And on the surface, that sounds like a good thing. The problem is the reaction from the drug companies. Some have kind of reached the conclusion that, well, if it's only a cap on covered drugs, we just need to cover fewer drugs. And so they've changed their formulary so that they don't cover certain prescriptions, which means that the consumer would have to pay out of pocket for those, and those don't count toward the cap. Other carriers are raising their monthly premium, where the average monthly premium for Part D plans in 2024 was somewhere around $38. In 2025, some carriers raise their price by up to $35, and they can do that again in 26. So that's $35 per month. So it's almost doubled overnight. And then other carriers are actually cutting broker commissions so that brokers cannot be compensated for helping consumers, which means that consumers are kind of on their own when searching for prescription drugs, at least for certain
Wow.
insurers.
Yeah, so it's almost like, hey, this is great that we're going to save our seniors, lots of money when they go to the drugstore or, the pharmacy. But now they're maybe getting hit in other ways with higher upfront premiums, or maybe even, they don't have these advisors ready to help them because the advisors aren't going to work for free. So hopefully, knock on wood, this will kind of straighten out and we'll get those, senior, better experiences, if you will, and lower out-of-pocket costs net, including premium increases. Hopefully it's not a bad thing long run.
Right.
But now walk me through what this means then for the creditable coverage side of the equation as well.
So as you would imagine, if the Part D plans now have a lower out-of-pocket maximum, that means there's a higher standard for an employer's plan to be creditable. Basically, there will be a new calculation to determine creditability. And again, Centers for Medicare and Medicaid Services, for 2025, they kind of gave employers a pass. They just said, use the old method of calculating. For 2026, it's sort of a transition year, so you can use the old method or the new method, which basically has a higher standard. And then in 2027, the old calculation method goes away completely, and we're just left with the new one. And that means that really some plans that were creditable previously now probably won't be anymore.
Wow. And so the net there is that if you're an employee who's Medicare eligible and still on your group health plan, the odds are likely increasing that you need to go ahead and go sign up for a Part D plan separately from your employer group plan. So we might have more 65 plus year olds or other Medicare eligibles that need to go get these plans. And the way they're going to know that is by these employer notices. So making sure those employer notices are accurate and correctly reflect whether that offer is creditable or not creditable is really important.
Yeah, it is very important for the employee's decision. Unfortunately, it's not easy. This is where I kind of feel like maybe we've failed our viewers this week, because we say we're going to take complex topics and make them simple, and this is anything but simple. It is a pretty complex calculation. I guess the one piece of good news, and this is my opinion only, it's not any sort of guidance we've received. I think that the insurance carriers are going to have no choice but to provide this information to employers. I don't think they're going to have the info that is needed to do the calculation accurately. And if that does end up happening and the carriers do actually provide the info, now it's a notice requirement as opposed to a difficult calculation. So it either could be really complicated, or it could be sort of business as usual as far as the notice requirements, but it may mean, as you said, that, employees make different decisions based on that guidance.
Gotcha. Yeah, and just thinking out loud, if you're on a fully insured small group plan, especially, or even large group, you may just have no ability to do these calculations because you don't have the data. Self-insured might be a whole different ball game, as that's a little bit more Wild West. But I'm guessing these rules apply creditable, non-creditable for both self-funded and fully insured group programs?
They do, regardless of funding arrangement, regardless of size, they apply. One other thing that I think is worth pointing out, and we have all of this info in today's article and today's topic, but it is important to note that if an employer changes plans during the year, which the vast majority will, unless a group has a 10/1 or 11/1 renewal date, it's very likely that the info that they send out October 15th is going to change at renewal time if they change their plans, the plan, design changes or anything like that. And if that happens, they do have a new notice requirement. So they need to send a new notice to employees and dependents, and they need to go back onto the CMS website and let them know. So, the notice portion of it is still as complicated as it always was.
Well, Eric, I mean, you mentioned we've got some great resources on the website. I know we've pulled together a great article, even some calculator tools. I think with that, we'll kind of leave it there because honestly, I think this is going to be a topic we pick back up in 2026 as this continues to unfold and we see these new calculation methodologies, maybe more group plans being non-creditable. What are the net impacts? This will be a fun issue for us to keep tracking. Hopefully, it's not going to drive folks in our industry too crazy. Well, with that, thanks again, everyone, for tuning into Benefits Weekly. Please dive into the content we pulled together as part of this topic. Let us know what you think. And as always, if you find it valuable, please share it with a friend.
Thanks, everyone.